Welcome back. Maryland, one of 20 states challenging the Trump administration's demand that states turn over personal data of people enrolled in a federally funded food assistance program known as SNAP. States attorneys general say that the information is protected by privacy guarantees and could be used amid mass deportations. Well, at the same time, the president's budget bill includes the largest cuts to Medicaid and food stamps in U.S. history. And a new report by our media partner, the Baltimore Banner, finds that these cuts could have a, quote, unmitigated disaster for Maryland children. Banner reporter Maya Laura joins us now. Good to see you, Maya. Thank you for joining us. A very interesting report that you filed, and you say that 1 in 10 Maryland households get SNAP or food stamp benefits. 1 in 10. Significant number. So what have you discovered about how these cuts could affect Maryland families and, most importantly, their children?
Yeah, researchers and experts are putting together some preliminary estimates, and right now it looks like 369,000 Maryland families could be impacted, meaning they'll lose either some or all of their SNAP benefits at an average of $81 a month for families with children. The bottom line is it means increased food insecurity for children, and it's not just children who are on SNAP. There are school districts that have high levels of poverty, and they use SNAP to automatically, they basically use SNAP as a way to communicate the need in their community, and that automatically gives them free meals for all of the students in a school. So there are students who are currently benefiting from free school meals, not because they themselves are eligible for SNAP, but because their neighbors are. And that could go down if less families are eligible for SNAP, and increased administrative burdens means that there are families who qualify for their kids who are not going to apply because it's going to be so much harder.
Wow, and kids need those free meals at school. So many children rely on them. All right, back to numbers. You also say 1 in 4 Marylanders are enrolled in Medicaid. Again, a staggering number. So how will these cuts affect children?
Yeah, Medicaid is a bigger program than SNAP when it comes to Maryland participation. Lots of kids are reliant on Medicaid, and work requirements are really the major change happening to Medicaid. And even though those work requirements are for childless adults, when they've been rolled out in other states, eligibility has gone down for everybody because there's massive amounts of confusion. People don't know if they're included. And research shows that when mom and dad don't apply for Medicaid, often their kids are also left off their health care.
All right, finally, very quickly, is the state able to prepare to make up for this need? What can be done?
That's a great question. I think everyone's figuring it out right now. A lot of these cuts aren't going to hit for a couple of years. So they have some time to find that missing money and try to plug those holes, and they're all working on it. But where they're going to find the money is a little bit unclear right now.
All right, really good report, Maya. Thank you. Very enlightening. If you'd like to read her story and other independent reporting from our media partner, the Baltimore Banner, head to thebaltimorebanner.com. Derek.